Good morning, everybody. My name is at Press Briefing. As usual, it is good to be with you. Good morning to all those on the channel, of course, the YouTube channel. Those of you in the diaspora, we're talking health this morning, and we have with us the Minister for Health and Social Security, the Honorable Nicholas Steele, as well as the Chief Medical Officer, Dr. Sean Charles, and the Assistant to the Chief Medical Officer, Dr. Mayana Charles. Without any further ado, I will hand you over to the Honorable Minister. Good morning.
Good morning, Les, and to all of our viewers and listeners. Good morning to you all. Let me start by saying that in the last 2 working days, that is Friday and Monday, we've seen a very positive change. We are averaging 1,000 doses per day. We're seeing a significant number of people coming forward to take the vaccine. As a result of that, I would say that we as a nation are seeing a light. And that light, by all appearances, is the light at the end of the tunnel. That light is the light that will guide us through and put COVID behind us. We want to thank all of the members of the public who have come forward to take their vaccine, and in particular, those who have helped to convince many who have had anxiety or concerns or so. We truly want to thank them too. It's not something that we can achieve on our own, but friends and other leaders have been stepping forward and speaking from a patriotic standpoint, from a medical standpoint, from a scientific standpoint, and it has been making a difference. As a result of that, we are now engaged in significantly positive dialogue with many members of our society. In particular, we have been having discussions with promoters for large events in which fully vaccinated persons can attend. Such events like the upcoming cricket, such events like football, and such events like small promoters or promoters wanting to have other activities or so, where fully vaccinated persons will be there. For me and for the rest of the team, this truly is a welcome change. That the future, we look forward to a much brighter future. We will endeavor to ensure that all those who want to be vaccinated will get vaccines. This has been a difficult trial for us, or exercise. Vaccines are quite likely the most valuable liquid in the world right now. And many nations continue to block the export and make it very difficult for countries like Grenada to acquire vaccines, whether by purchase or donations. But we have persevered and been able to acquire. And we are now seeing our public coming forward to take the vaccine. This helps us greatly because it's very difficult, if not impossible, for us to get additional stocks of vaccines if our own population aren't taking the vaccines. So this trend that we've seen this week greatly assists us in our abilities. But we have been totally transparent with the public to date, and I want to say, as of yet, we do not have a replacement stock, that what we have will expire on the 27th and 30th of June. But we do have enough to give another 10,000 people their first and second doses. That's additional 10,000 who have not come forward as yet. And we are looking forward to being able to do that. And in us doing that, allows us to engage Pan American Health Organization, WHO, and other nations to say, give us more, because we are using it properly. So I want to thank all of those involved in this endeavor, in particular, as always, our frontline team who are there disseminating the vaccines, our nurses, community health nurses, the volunteers from WINREF SGU, St. George's School of Public Health, our wardens, our police officers who have been helping, all of our volunteers that have been helping, our church leaders who have been facilitating, our parliamentarians, our opposition, our trade unionists who have been participating in this positive message. And we want to thank them and ask that they keep up the good work. Thank you.
Thank you very much, Honorable Minister. We go now to Chief Medical Officer, Dr. Sean Charles.
Hi, good morning. So certainly the news today is quite encouraging. Today I'm kind of wearing a smile, although it's hidden under the mask. So it seems that all our efforts are certainly showing some positive results. As you know, for the past weeks, we have been stepping up on our efforts to educate and encourage and persuade persons to take this step to protect your health. And we are seeing very encouraging signs that the message is reaching the population out there. We have seen a very good uptake in the vaccines, particularly in the last 2 working days, as was alluded to by my minister, with us vaccinating over 1,000 persons a day, which is remarkable. All right. What it means that more persons are protected. All right. With every individual who receives a vaccine, it's one less person that we have to worry about having, severe complications as a result of this disease. All right. It's one less worry for that individual and their family. When they go out there, that they may at some time in the future encounter this disease. All right, so it makes us all stronger. With every shot in every arm, we are stronger. All right, we build immunity each day. So we want to encourage the public to continue. Let us continue. All right, this is the right path. All right, this is the path that every country is embarking on right now. The goal is to ensure that as many of your citizens are vaccinated as possible, so as many of your citizens are protected. So we want to recognize our team that is out there making this possible. Our team of nurses, all of our volunteers, all of the agencies that have been out there in the field with us. Especially want to recognize our team from SGU who have been with us from day one, and especially in this vaccination drive. They have volunteered off their time every day at the vaccination sites to ensure that we can reach our population. We want to recognize also all of the other agencies and businesses that have assisted us in one way or the other. Like I say, this is very encouraging. We are certainly happy to see that truth is winning over the disinformation that has been out there. And we will certainly do everything in our power to ensure that we can continue to take all the measures that is necessary to protect our population, to make the best decisions in the interest of the health of all in the population. Thank you.
Thank you, Dr. Sean Charles. We go now for brief comments from the Assistant to the CMO, Dr. Mayana Charles. Good morning.
Pleasant good morning to you, to the viewers and to the media representatives. I would like to start with the COVID-19 situation report for Grenada. To date, Grenada has recorded a total of 161 COVID-19 cases, of which 160 have recovered. There has been a total of 6 hospitalized cases and 1 death. There are currently no active cases. In fact, the last active case was detected on April 27th and have since recovered. There is 401 persons in quarantine facilities at different stages. Over 29,000 PCR tests have been conducted, and the 22,593 AstraZeneca vaccine doses have been administered. Of that, over 15,500 persons have received their first dose, and over 6,500 have received their second dose. Now, this is very encouraging. And on last Friday, as mentioned previously, 1,135 vaccine doses were administered, and yesterday, over 1,000 doses were administered as well. Now, this is a great accomplishment and shows what we can achieve as a people when we come together. For that, I want to commend my Grenadian people for going out there and getting vaccinated, for utilizing one of the most important tools to end this pandemic, for recognizing that we are all in this together, and for being selfless in their act to protect the persons under the age of 18 that are not eligible for the AstraZeneca COVID-19 vaccine. Now, again, as I said, this is very promising. And I want to also thank everyone that made this possible and continue to support the vaccination drive. What does that mean for us? It means that we are closer to achieving herd immunity. It means that we are closer to achieving community protection. It means that as a nation, we are stronger against the fight against COVID-19. And I want to remind those persons who have not yet gotten the vaccine about the benefits of being vaccinated. The AstraZeneca COVID-19 vaccine significantly protects you from severe illness, death, and hospitalization. Studies have shown that it is safe and effective. Additionally, studies have shown that it is up to 68% effective in reducing transmission. So there is significant benefits to vaccination. So for the persons who have not yet received the vaccine, I want to encourage you to go out there and get vaccinated and to join us in the fight against COVID-19. Thank you.
Thank you, Dr. Charles. So, colleagues, you have heard from the Honourable Minister Nicholas Steele, as well as CMO Dr. Sean Charles and Dr. Mayana Charles. It is time for your questions. Good morning. Anybody ready with their questions as yet? Nancy Maguire?
Good morning.
Good morning. Go right ahead. We're hearing you.
Sure, everybody gets their second shot. Could you just clarify on the numbers? And secondly, Minister, a while back you had said we were looking into vaccines from China and Russia. They were not approved yet by the WHO. So what routes are you taking to ensure the next shipment of vaccines? Thank you, Minister.
Yes, statements last week, I think I was misquoted or misunderstood. You can take the time period between the first and the second dose is between 4 and 12 weeks. And it's advised to take it around week 8 or week 10. But you are fully protected if you take your second dose between 4 and 12 weeks after your first. So therefore, as of Monday, what we are doing as a people is reducing our flexibility in taking that second dose. We're sort of tied to taking it 4 to 6 weeks afterwards. Still fully protected, but we are giving up our flexibility. And I think that is why persons are coming forward. And we're seeing that significant increase, because persons want to make sure that they get their first and their second dose. So it is still possible. And as I said, we are working overtime to see if we can get, or when we can get, another shipment. But we will continue to make sure that the persons who want to get vaccinated get vaccinated. With respect to the other vaccines that are available, we still stick to our principle, which is that we will not bring any vaccine here that is not approved by the WHO. the vaccines that are approved by the WHO right now are the Pfizer-BioNTech, AstraZeneca, Moderna, and Sinopharm. Sinopharm, we have made a request, but we are very much aware that there are challenges in getting any of the vaccines right now. But as I said, we are working overtime to get, I'm sorry, Johnson & Johnson is also approved. We are working overtime to get approved vaccines for our population.
That's it for now, Nancy.
Yes, thank you.
All right, colleagues, anybody else with questions?
I have two questions.
All right, good morning. Identify yourself and go right ahead.
All right, so this is Troy Gill with MTV News.
Go ahead, we're hearing you.
Right, so at this current rate, how close are we to achieving herd immunity at this current rate? And my second question is, we know that students were at home during the height of the pandemic. However, they are now back in full capacity. But we have recently witnessed that that acute respiratory infection affected a number of students, resulting in them being home and so forth. And we know how important it is for students to continue their education, especially noting that they would have missed quite a bit during the height of the pandemic. So what measures are in place to ensure that students continue? Because I know it was used as a yardstick to determine how quickly COVID-19 is going to spread, considering that it's very highly transmissible. And I know there was talk that that there are reports that is going to be possible that the age group is going to be lowered to 12 for persons to get vaccinated. So could you just kind of highlight for us what measures are there to ensure that students are protected?
Well, let me, with respect to getting to herd immunity, it's approximately 80%. Approximately, somewhere between 60 and 80%. And every day that we disseminate 1,000 doses, we increase by 1%. So at our current trend, last week we were 20% of the population, thereabouts. So another 60 days like this, and we're out. We're covered. So you can use that to determine as we move forward. Every day of 1,000 new doses is 1% increase, getting closer to that herd immunity, somewhere between 60 and 80%. So we can see that. With respect to the protection of our students, this is part of it. The more adults that get vaccinated, the more students are protected. The influx that we saw recently of rhinoenterra virus comes from not students traveling. Students don't travel on their own, leave the country, come in or so. It's adults with kids or adults alone. So if we, above the age of 18, take the vaccine, then whether we're traveling or not, whether we're interacting with people traveling or not, we will be protecting our students as well. And we look forward to the day when we can say that the vaccine is now approved for individuals under 18. And we are sure that many of the households that have taken that step to protect themselves and their loved ones will also have their individuals under 18 or between 12 and 18, whatever that age limit is when it comes, that they will come forward too. That brings us closer and closer to that herd immunity figure. So it's all positive. It's all in the right direction. And we just need to ride out the end of the storm.
Thank you, Minister. That's it for you for now, Troy? All right, so we will...
Yes, thank you.
All right, great. Great. Linda Straker, good morning.
Good morning.
Go ahead.
Are you hearing me?
Yes, we are. Go right ahead.
All right, great. Great. Linda Straker, good morning.
Morning. Are you hearing me?
Yes, Linda, we are. Go ahead.
Okay. Just hold a second, please. Sorry about that. Yesterday, Minister and Dr. Charles, the police would have sent out a press release explaining that somebody was charged. And I followed up by asking what has happened, what is the condition of the shopkeeper, the shop where the person would have visited. And the police tell me I should speak to the Ministry of Health. So that's why I'm asking you the question. Can the Ministry of Health give us an outline as to what has happened to the shop where the person was found? And whether persons in that community is being tested for COVID?
All right, so let me answer that question. So this individual was, he's being processed for breaching our quarantine rules. Now, it just so happened that this individual's PCR tests is negative. If it was the contrary, if the individuals did turn out to be a positive case, then so if the individual did turn out to be positive, then all of the persons that he had contact with, including the shop, including everyone who he came into contact with, they would have been placed in quarantine for a period of up to 14 days, and we will test them and follow them up to see if they were infected from him. All right. Given that that wasn't the case, then it was not necessary to quarantine those individuals because the gentleman tested negative.
Thank you. Linda, any other question from you?
Can Dr. Sean explain to us the condition of the shop? Has it given the permission to resume opening?
No, the shop was not placed under lockdown or quarantine. So there was no need to grant further permission to open. Like I say, if it turned out that the individual was positive, then it would be the opposite. The shop owner and whoever else would have to quarantine, and they would be in lockdown, and the shop might be closed as well. But that is not the case.
Thank you, CMO. Anything else, Linda, from you?
On the next one.
All right, GBN, good morning.
Good morning. Renata Thomas here, GBN. I have 3 questions. What kind of guidelines would be laid down for promoters? Is it the same as weddings as it relates to the venue, the size of the venue and the number of persons? And as it relates to the respiratory infection or virus, I don't know which one is the term that we've been having issue with. I got information that there, especially in the Maribor Hospital, Princess Alice Hospital, that there's a lot of young people coming down with the respiratory illness, which we are already aware of. And they have a lot of issue with breathing and stuff like that. Do we have the necessary medicine or equipment, such as oxygen and stuff, to aid these patients? And I know last week we said, Dr. Charles said that we had a lot. Is it getting worse, or are we seeing anything happening as it relates to it decreasing? My final question, CDC issued statements a couple of days ago that persons who are fully vaccinated can walk around with their mask off. Is Grenada considering that in the near future?
Let me take the first and the last question, and Dr. Charles can add to any of them. With respect to the protocols, the COVID committee, advisory committee, is finalizing those protocols, and we will make that public. I am hoping by the end of this week we will have those protocols in place, which will take into consideration the safe congregating of individuals at these large events, being able to verify that individuals are fully vaccinated and to maintain that bubble for those who are there. I look forward to their report and the conclusion of these protocols, because I'm looking forward to seeing as many of you as possible at football or cricket or any of these events. I think the time has come for us all to be able to exhale. No pun intended there, but for us all to be able to exhale comfortably. On the third question was CDC statement. Yes, CDC statement is one that we are looking very closely at. We agree with their rationale. It's the same thing that we've been saying. Fully vaccinated or herd immunity will allow us to get past all of these measures. Their statement is made based on the strength of their health system and the risk currently in the United States. They are approximately at 30% of their population vaccinated. We are at 20. We do agree that as we increase, we get closer to that. And we do agree that individuals who are fully vaccinated are significantly reduced with the risk of infection or transmission. So we're all speaking the same language. It's just that we are not yet at that destination, but I think it is something we should all aim for and try and get there as quickly as possible.
As it relates to the cases of acute respiratory infection, it continues. I expect the numbers to be similar to last week, or maybe a little higher. Once we have all the reports in for this week, we'll be able to make that public. Yes, this disease has affected different areas of the country. We started out by seeing more cases around St. George, and now we are seeing in the other areas. We have tested, and these cases have tested negative for COVID-19. And as I mentioned previously, we did identify rhinovirus as one of the causes. Now, we also mentioned that this is a signal that persons are not obeying the basic measures to prevent the spread of disease. If we were wearing masks as consistently as is recommended, we will not see this level of disease. If we were distancing, if we were sanitizing, we will not see this level of disease. So we, continue to encourage persons to do this. Now, with regards to treatment, there is no specific treatment. There is no drug that you will be prescribed to treat this virus. All right? So the answer to that question is no, there is no specific treatment. The treatment is based on the symptoms. If there is fever, you may use an antipyretic or something like Panadol or so. All right? And then there's rest and, eating healthy and, drinking fluids and so on. It is how you have been treating the flu for some time. If there is anyone who has severe symptoms, well, of course, you may require additional attention, which you can seek at one of our health facilities. All right, and the treatment will be based on your symptoms. Is it getting worse? As I say, I'll be able to tell you that once we're pulling all of the weekly reports, which should be done just after midday today.
Just to quickly clarify, Dr. Charles, in speaking about the necessary equipment, maybe I should be a bit more specific. The thing that we've noticed, or the information I've gotten, there's a lot of issue with persons coming who has the respiratory virus coming down with issue of breathing. And let's say maybe somebody has an asthma attack, whatever the case may be. Is there enough oxygen in the hospitals to help? I know we had issues before, but presently, do we have these things in place to ensure that we can deal with the issue?
So maybe the question you're asking is, if we have a large outbreak of disease, if we have sufficient oxygen to treat everyone, maybe that's a more accurate interpretation. Well, what I can say is there's a reason why we have been emphasizing the need for prevention. All right? Because if you prevent these things from occurring, then the demand on the system will not be that large. Now, this is similar to what will occur if we end up with a COVID-19 outbreak. We have witnessed how this disease has overwhelmed even well-developed health systems. All right? We know that our systems has limitation. If we do get a massive outbreak of any kind of respiratory disease that requires a huge demand and there's a huge demand for oxygen, we will be strained. We will not have enough, just like the other health systems. All right, we will be pushed to a limit. All right, so this is one of the challenges that we have been grappling with, and that is why we are preaching prevention. All right, we are aware that we have some deficiencies. We are still asking everyone to, do your best to ensure that we do not reach that point.
Thank you, Dr. Charles. That's it for Norina?
Yes.
All right. Callistra Faria, good morning.
Good morning. Thanks, Leslie. Just to follow up on Rena's questions, what would it take for us, given our population size, we're just barely over 100,000 people, and we've had an entire year to anticipate the possibility of an outbreak that would require us to have oxygen on hand. What would it take for us to meet the numbers that we can anticipate? Do we do modeling for the worst case scenario and decide this is what we require? And what would it take for us to do that? Have we tried? Why is it at this stage with 100,000 people, we're still saying that we would be strained for producing oxygen to meet those needs? Can you explain those situations for me? And also the taxi driver, I believe he admitted that he took the gentleman who came from the United States home rather than to the facilities. Is the Ministry of Health placing any sanctions against that taxi driver? He proved to be one of the weakest links in our prevention chain. Any sanctions against him? I noticed the police did not announce charges against him. Can he be charged, or if not criminal charges brought against him? Any sanctions on the Ministry of Health? Is that taxi driver going to be allowed to continue to operate?
Yep. Callistra, modeling and preparation always includes prevention. All countries, because if you do not actively try to prevent the spread, then you cannot possibly have enough beds, oxygen, etc., for any population. So you will see every single country where there have been outbreaks, it's not just simply about, well, we're all good because we've built enough beds and have enough oxygen. They will have restrictive measures as well, and that's also involved with the modeling. So we have taken those necessary steps from the beginning and always recognize our capacities are limited, and therefore we always went on the side of prevention more than just planning for. We have planned with respect to oxygen, because I think that's a specific question that you're following up from. We have put steps in place, and I can confirm from our Minister of Hospital Services, Hospital and Community Services, that we have between 30 and 60 days of oxygen on island always, constantly being replenished. And that is the safety mechanism that we have there. On the other side, it is to make sure that we do not inundate the health system. Because if left unchecked, no matter what preparations you make or what contingency plans you put with respect to number of beds, number of oxygen equipment or stock of oxygen, it will inundate you. So it's a balance as we move forward. I can say that the taxi driver has been suspended. A privilege, and I think it is a privilege, and a right, but a privilege for him to be working at the airport, trained, and given that opportunity to earn an income while keeping us safe, and he took that for granted and has been suspended. It is a discussion, I am sure, with the DPP and the police as to whether he would be charged or included in any. That's not up to us at the Ministry of Health. That is for the police and the Director of Public Prosecutions. But with respect to the individual having the ability to continue to work in that environment, no. That privilege or that right has been removed from him from a health standpoint because he has put our nation at risk.
Thank you, Minister. Anything else, Callistra?
How long is suspension? You said, I didn't hear you. You said he was suspended, and if so, how long?
That's a discussion, I think, between the GTA. They will include the Ministry of Health and the Taxi Association to ensure that when they are comfortable, or all parties are comfortable that he will. It's not simply meant to be punitive at all. It is to make sure that it doesn't happen again. So in the interim, there's a suspension, as you have seen with other establishments. So there's a suspension and then ensuring. We want to make sure people get back to maintaining their lives and their income. But there has to be a process when we see that someone has taken the system for granted.
Thank you. That's it, Callistra?
Sorry, my final in this round. Minister, last week you gave the impression that we were in dire straits in using up the vaccine doses that we have. This week, it appears that there is still a bit of a window. I may not be very clear on what I heard earlier, as I came in sort of late. I got the impression that you were saying there's still a window for vaccines that we have on hand. But last week, it could have been my mistake, but I got the impression that we were really at the end of the line, and May 17th would prove to be the do or die day for us. Can you clarify and explain why we got that sort of tolling of the bell message last week?
Yeah, Callistra, I did clarify, but I'll repeat it again. WHO advises with respect to the AstraZeneca vaccine that is taken somewhere between 4 and 12 weeks, the second dose that is. First dose, and then between 4 and 12 weeks to take your second dose. Obviously, if the stock that we have will expire between the 27th and 30th of June, we as a people, we as a nation, are limiting our ability to take it 8, 9, 10, 11 weeks afterwards, and we get closer and closer to that window. I think people have recognized that and are coming forward so that they can get their first and second dose. And as I said, we are working assiduously to make sure that we can get additional stocks, and our ability to get additional stocks is predicated on us being able to show the world that we are using all that we have. In the last couple of days, we are getting close to that. We have seen this very encouraging trend of individuals coming forward to get their first dose. We continue to see individuals coming to get their second dose, and it helps us tell the world, tell the first world nations, demand from the first world nations, or continue to demand from the first world nations that we be given the opportunity to purchase and access more vaccines. So it is a positive trend, and I think the message was well received by members of the population, that if we had continued to hesitate, we would be closing that window. And no, the window is not closed, because individuals can still, those who are coming forward, will still be able to get their second dose, and we will continue to update the public with respect to if and when we have access to more vaccines. And right now, in the same way we have been transparent from the beginning, we do not have any lead right now on additional shipments of vaccines.
Thank you, Minister. Nancy Maguire, good morning.
Leslie, I'm so sorry. I must apologize. Just to follow up, though, the nurses, the CMO had said that frontline medical healthcare workers were not getting vaccinated. Have we seen a change in that? And how are you addressing the concern of the doctors and the nurses at the hospital who are within that age range where there's some data saying that the vaccine could be, there's possible major side effects to the vaccine? I know that's one of the concerns researching among nurses and doctors here in Grenada. That's one of the concerns that was expressed, that they are within that danger age group, and that worries them. Any change in the numbers in their vaccination rate, and any plans to address that? Any method being planned or deployed to address that?
We're seeing a significant uptake within our frontline workers. I can say, based on the figures that I received last week, almost all of our doctors, save and except maybe somewhere between 5 to 10, have taken the vaccine. And we're seeing a significant number of our nurses stepping forward, like the rest of the public. It's not unique to any society. We're seeing members of Grenadian society from all sectors and segments coming forward to take the vaccine now.
Nancy Maguire, you have
Yeah.
just a second, Nancy.
Yeah, I wanted to add that yes, some of our staff have gotten over their initial hesitancy for the vaccine. Vaccination is offered, for example, at General Hospital weekly, every Friday, and slowly we have seen that persons have been coming out and getting vaccinated, and the same applies across the board. That initial hesitancy is slowly fading. I wanted to answer one of the questions that was asked with regard to the numbers of cases of acute respiratory infection. So far, what was just sent to me, so far we have registered 324, and that is up from 133 last week. So the number of cases are still quite high.
Thank you, CMO. Nancy, go right ahead now.
Yes, thank you. Earlier you had talked about, when you were talking about promoters and maybe some revisions to the events, you referred to vaccine verification. And what would be vaccine verification? What form would that take? And I'm like Callister, I'm going back to these doses. Is there, given the number of doses that we know we have, and the number of people in the country that we would like to get vaccinated, going forward now, is there going to be a cutoff date to ensure that everyone that has had their first dose will get their second dose, understanding that we will not get any more vaccines before these expire? Or am I jumping to conclusions there? Thank you.
Yes, Nancy, on the second question, you are jumping to conclusions, respectfully. I've said we continue to try and access additional stocks of vaccines, and we'll continue to update the public on that. And at this point in time, we do not have additional stocks of vaccines. But we do have enough, as I said earlier, to give an additional 10,000 individuals. We are seeing individuals coming forward, and that is first and second dose. And we will continue to monitor and update members of the public. With respect to verification for fully vaccinated events, that is what is being discussed now between the organizers and the COVID committee and law enforcement to have that mechanism. I mean, simply we can all consider that you present your vaccination card, but we're trying to put a measure in place that does not have to have us walking around with our vaccination cards, but to have, for instance, if it is for the cricket or GFA or so, tickets sold in advance are sold to an approved list of individuals who are fully vaccinated. That's the mechanism that's being discussed. and to find a mechanism that protects individuals' privacy, but allows us to give access to those who request it to be present at fully vaccinated events.
Thank you, Minister. Nancy, that's it. Colleagues, we have about 10 minutes roughly left. Anybody else with questions?
Yes, I have 2 additional
Okay,
questions.
right. Troy, just 1 second. Let's just finish with Nancy. Nancy, was that you? Go right ahead.
No, that wasn't me. I'm finished. Thank you.
That was me.
All right.
Go
Sorry.
ahead, Troy.
Go ahead. So, Rena, we come back to you. Troy, go ahead.
Okay. There are unconfirmed reports that someone died shortly after receiving the vaccine. Can you confirm if there's any truth to this? And my second question is not as it relates to the vaccine. There has been a sharp increase in the number of dengue cases. How much of a concern is this for the Ministry of Health? Thanks.
Troy, I've said previously, and while our condolences go out to the any family member who has lost anyone in the last couple of weeks, the vaccine does not give you immortality. The vaccine gives you immunity to COVID, and we have absolutely no evidence at all or suspicion of anyone dying from the vaccine at all. I want to be very plain and direct with that. There's absolutely no evidence or suspicion of anyone dying as a result of the vaccine. That is very different from someone dying afterwards. They're two separate things, and I'm asking that members of the media and public be responsible on this. There is a difference, and we need to recognize that. There is a transparent reporting system, and we are duty-bound to do so, not just to the public here, but to the Pan American Health Organization and World Health Organization. But there is no evidence and no suspicion of anyone dying as a result of the vaccine.
Right. So we will go now to Rena.
Wait, he did ask a question on dengue.
Okay. All right.
Now, what must be remembered is that dengue is endemic to our region and certainly in Grenada. Dengue is spread from person to person through the bites of the Aedes aegypti mosquito. This mosquito thrives in settings where it likes to inhabit around homes and businesses and so on. So it's a sort of domesticated mosquito. This mosquito can only thrive if the conditions exist, meaning there are available water sources for it to multiply. So if we notice that there is a rise in the number of cases of dengue, it is because there are increasing number of sites around homes and dwellings and businesses where the mosquitoes can thrive. So this is where we require everyone's input. All right. If there are increasing number of cases of dengue, we encourage everyone to examine your surroundings and to see where the mosquito can multiply and get rid of it. And that is the only way we can get control of this. As we approach the rainy season, there will be more, there will be more avenues for there to be collection of water due to rainfall and so on. And, seasonally we would see number of cases of dengue rise as a result of this. So the number of cases of dengue is concerning, but at the same time we have the wherewithal, we have the powers in our hands to ensure that this is not so. All right? Get rid of the breeding sites. No mosquito, no dengue. Thank you.
Thank you. So we go now to Rena Pierre.
Yes. Dr. Charles, as you speak about dengue, if you have any numbers, could you give me numbers as it relates to the amount of cases we have now if there's any. Minister Steele, to you as it relates to, I know you spoke about AstraZeneca vaccine and being able to get them, or the second dose or more for us in Grenada, but what about sourcing vaccines, other vaccines than AstraZeneca? How has that been going? And while you're speaking about that, could you tell us, some people are showing more interest in the Cuban vaccine. Have you ever tried, or has the government ever tried getting that specific vaccine? It was approved by the WHO. So what is happening as it relates to that?
Yeah, that one left me a little puzzled, but
With respect to the other vaccines, we are continually trying to source those that are approved by the WHO. The Cuban vaccine is not yet approved by the WHO. So while we have had initial discussions with them and others, we will not have any final discussions with respect to quantity or timing until it is approved. As to whether that happens in the next 2 or 3 or 6 months, we're not sure. But we do know that it is, in most cases, a lengthy process. And it is not something that we should place all of our expectations on. If and when it is available, we do know, based on the relationship we have and the attitude of the Cuban government, is that they will make it accessible as best as possible to all of us. What we are struggling against right now is other countries not making the vaccine accessible to countries like Grenada, as we would like to see, or as the world and the WHO would like to see. So those are the challenges we have at present. We cannot afford to wait. Time is of the essence. We are, as I said, seeing the light at the end of the tunnel, and each and every one of us want to get past this. And the quickest way to get past this is to take the approved, accessible vaccine, and right now that is AstraZeneca.
all right. So with regards to dengue, we have 5 cases reported this week. Now, briefly with regards to the Cuban vaccines, Cuba has several vaccines that are presently being studied. They are in trial. Cuba does not yet have an approved vaccine, even for emergency use. They are presently conducting clinical trials. I know that this has been, one of the topical areas. But I mean, there's an old saying, a bird in hand is always better, all right, than all of the other birds that are out there. I'm sure that eventually, when the Cuban vaccines become available, and mind you, Cuba is one of the countries that is not receiving vaccines from the outside. Cuba has a population of about 12 million persons. Right now, they have vaccine candidates that are being investigated. They have a population. They have that has not, been vaccinated as yet. They have community spread of COVID. They have a number of variants. All right. So Cuba is eagerly waiting on the Cuban vaccine as well. All right, so we must understand that. All right, Cuba is also awaiting the Cuban vaccine. So, I would encourage everyone to use the vaccine that is available to you. All right. We do not have an expected date for any other vaccine. What we can tell you is that we have a vaccine in hand right now that can protect you, that has been proven safe and effective, that has been granted authorization by WHO and by most other agencies around the world. All right, use the vaccine that we have.
I think just to add to that, while our thoughts and prayers go out to our brothers and sisters in Trinidad and Tobago, I'm sure if we speak to any of them, they will say, don't wait. Don't wait until it gets to the situation that they're experiencing now. In staying ahead of the game, staying ahead of the curve, and getting the vaccine before there is an outbreak and 10 or 11 people dying per day is the appropriate route to take. And if we do that by utilizing the vaccine stock that we have, we quite likely, with the grace of God and our collective cooperation, avoid totally an outbreak like we are seeing in Trinidad. And that is, I think, what each and every one of us want to do, to not have that as part of our COVID-19 story or experience.
Just have a question from social media. Somebody's asking about the likelihood of removing the 48-hour quarantine for visitors who are fully vaccinated.
That is a very good question. As more and more of us get vaccinated, the risk of someone coming in and causing an outbreak in Grenada is reduced because the herd immunity effect comes into place. But right now, the quarantine, whether for fully vaccinated or unvaccinated persons entering Grenada, is to protect us, but more importantly, it is to protect our unvaccinated population. Those of us who are fully vaccinated are significantly not at risk to COVID-19 causing severe illness. But as long as we have a high percentage of Grenadians still unvaccinated, it is necessary to protect them all of us. So it has to remain until we get to a certain level. We look forward to it being removed. It's taken a significant strain on us, manpower-wise, psychologically, etc., on all of us. And it can and will be removed if we are at herd immunity or close to herd immunity. And we're also seeing a significant number of the individuals who are coming in are fully vaccinated. And I think the question was specific to the 48 hours, but I'm addressing quarantine as a whole. It is to make sure that the person who enters Grenadian society is COVID-19 negative. And there's less risk, and that's why there's 48 hours for somebody fully vaccinated and 7 days for somebody not vaccinated. But it is there to make sure that persons don't infect Grenadians who are at risk. And we still have a significant number of Grenadians at risk.
Thank you. All right, so the final question goes to Linda Stricker. Go right ahead.
Good morning again, and thanks. My final question has to do, the minister would have mentioned that there is, I think, a 60-day supply of oxygen. Can you tell us whether that 60-day supply is based on traditional use per day, based on the normal circumstance, or is it based on a worst-case scenario where there is somewhat of a breakout of the need for oxygen, not necessarily COVID, but there are other things that would result people wanting to use oxygen. So is that based on a worst-case scenario, that's 60 days? And lastly, can the minister also tell us whether or not there has been further increase in illegal immigrants coming in? Earlier, a few weeks ago, the commissioner mentioned how we are already break the amount of persons, it broke the record for the number of persons who have illegally entered Grenada. I have noticed we have gotten documents that the Immigration Act is being amended to increase the fine for persons who assist in doing that, or would that person come on their own. So can you tell us if there has been more persons caught at the borders coming in illegally, and whether or not the amendment to the Immigration Act is tied to the growing number of illegal immigrants to the country?
But Linda, it's based on the current capacity to deal with, and you mentioned worst case scenario, but worst case scenario, many countries have gone beyond their worst case scenario. So we are concerned when we see what's happening with neighboring countries that they've blown through their worst case scenario quite quickly. We ensure as best as possible that there is the maximum amount of oxygen available with respect to storage limitations and usage limitations. If we were to see an outbreak like we're seeing in Trinidad and Tobago, we would very quickly get to, before the maximum use of oxygen, we'd get to the maximum use of beds first. So we have ensured that for the beds we have, there is oxygen 60-day supply. I think the question further should be looked at in terms of we will blow through bed space first before we blow through oxygen usage, should there be that type of outbreak. Your second question, I don't have any recent report from the Commissioner of Police or police on illegal immigrants or so, or individuals caught illegally entering Grenada. We will ask the question, and I'm sure GIS can give an answer, whatever the answer is. Doesn't mean that we don't need to still maintain our level of due diligence at our borders. I think we always have to be cautious. But I don't have a report on any recent charges or so. Not really. When on Friday, I think we will elaborate a little more, but no, it is not tied to that.
Thank you very much. So, colleagues, we are about to wrap up. We'll have final comments. I'll start with Dr. Mayana Charles, then I'll go to the CMO, and we'll have the final word from the Honourable Minister. Dr. Charles?
In closing, vaccines remain accessible and available to all Grenadians in all the health centres throughout the island. Also at the National Stadium from Monday to Friday at 9 a.m. to 2 p.m. at St. Augustine Hospital on Tuesdays and Thursdays. If you are 18 and over and have not yet been vaccinated, I want to encourage you to join us in the fight against COVID-19. I want to encourage us to use this protective tool, to use prevention. As they always say, prevention is much better than cure. And this is what vaccination does. It is a tool that will help prevent, right? And I hope the scenes that we see throughout the world, if we are not yet convinced, will convince us that the call to vaccination is urgent. The call to vaccination is now. Now, though the numbers that I've quoted earlier is very promising, we have to acknowledge that a large percentage of our population still remain vulnerable, right, if we do encounter an outbreak here in Grenada. So let us all join forces and let us go out there and get vaccinated.
Thank you. Dr. Sean Charles?
Yes, in closing, I would just like to once again say, recognize all of the persons who have taken the decision to go out there and get vaccinated and ensure that we are all protected and we can get back to normal. I am happy by the trend that we are seeing. We are seeing increased number of persons going out there and getting their vaccines, and this is good. All right, this is a good thing. I was looking at a program last night on one of the media houses, and one of our local veteran physicians says, take the vaccine as a show of patriotism. That's one of the most patriotic things that you can do for your country right now, because it's not just for you. It's to protect all of us and to ensure that we can get back on our feet, get back to normal, and to ensure that we're all protected. All right. So do it for yourself, do it for your family, do it for your country. Get vaccinated. All right. That is my encouragement to everyone today.
Thank you, Dr. Charles. Honourable Minister, final words.
Yes. Let me again thank all of those who have been involved in the results that we're seeing now. Those who have stepped forward to take their vaccine, those who have assisted in having individuals come to that decision, those who are involved in actually giving the vaccine. I want to thank all of the individuals, but in particular, those who are coming forward to take the vaccine. The question is still out there as to what is the best vaccine to take. The best vaccine to take is the one available. To wait would be to continue to put yourself at risk. And we do not want to find ourselves in a position where we've been waiting for a specific vaccine when all the approved vaccines are safe and give the required protection. To wait for a specific brand would be foolhardy and would put ourselves at risk, and it may not come in time. So take the vaccine that's available. We will endeavor to get more vaccine stocks. It is only with this collective effort are we able to better get vaccine stocks by showing the world that we are utilizing the most valuable liquid that exists right now, the vaccines, that we can plead, we can push, we can demand, and we can get additional stocks. So let us continue to follow that light and get out of this tunnel called COVID-19 and put this dark period behind us. Let us begin to celebrate and think positive of the future that we are seeing, which is a future without the risk of COVID. We have been able to date to manage the risk of COVID in Grenada and learn how to live with the risk of COVID in Grenada. But by getting fully vaccinated, we remove the risk of COVID-19, and that's what we all want to get to. Thank you.
Thank you very much, Minister for Health and Social Security, the Honourable Nicholas Steele, Chief Medical Officer Dr. Sean Charles, and the Assistant to the Chief Medical Officer, Dr. Mayana Charles. And of course, colleagues, thank you so much for those of you joining us on Zoom, as well as the viewers on Channel 22 of Facebook page and the YouTube channel, and of course, those of you in the diaspora. So the information we had yesterday when we got the COVID-19 dashboard, that was 1,004 people received their vaccines yesterday. 803, just to give you a breakdown, 803 of them received the first dose and 201 received the second dose. So of course, we're doing very well. And if we want to achieve the herd immunity, we have to ensure that we continue and utilize the vaccines that remain available. I'm Leslie Ann Johnson. Thank you so much for being with us today.